Wonderful. So thank you so much for joining me on this webinar, and I'm going to introduce to you some new ideas about our ears and help you engage and become attuned to Ear Talk, the title of my new FHT accredited online workshop. Did you know that our ears can be used as a window to the brain, as Muriel Agnes says, and they can easily enable us to access nerves such as the vagus nerve and deep regions in our brain to change our brain chemistry. This phenomenon might sound far-fetched, but it is actually one that is scientifically and clinically evidenced. We can certainly have the functional MRI scans of Romoli and others to show it. So knowing how to change our physical, emotional and mental health when informed by visual inspection of the ears, assessment of skin alterations that appear on the ears, and tender testing of acupoints for the most active ones is what Attuning to Ear Talk introduces you to in this little vignette of my 2-day FHT accredited interactive workshop, which I'll tell you more about towards the end. So I hope you'll join me for the next hour or so by connecting and sharing over ears and most probably other body parts, including feet, as we draw parallels with the use of microsystems. Lots of us on here are reflexologists, Reiki masters, holistic therapists, body acupuncturists, a range of therapists, massage therapists I've come to learn too. So the reflexologists among us will be familiar with Eunice Ingham's book entitled Stories the Feet Can Tell, Stories the Feet Have Told. Well, similarly, I'm going to tell you about stories that the ears can tell and stories that the ears have told if we learn to listen to and make sense of the information given to us. I'm going to show you an image of my own ears and the medical file that is held on them relating to my past, present and future self. And I'm also going to tell you stories about some of the people I've been lucky enough to work with in my career of 26 years working as a reflexologist, aromatherapist and a specialist auricular acupuncturist and auricular therapist too. But first, I'd like to ask you to share in the chat. I think most of you now know where it is. So it's just towards the bottom right of the screen in the little speech bubble. What I'd like to share is when we work the feet and other body parts, what information can we discover about our client's health? What maybe emotions, health, maybe even life events? What can we discover about their health when we work their body parts? What health states or conditions might we get an insight to? And just to say as a quick disclaimer, we're not diagnosing here. We're just gaining an insight and interpreting the health status of the patient from the ears. Okay, if you could just pop your ideas in the chat for me, that would be marvelous. Just get the chat up so I can have a little look. Imbalances in the body. Absolutely. Tanya, thank you. Areas of dysfunction. Anyone else? What can we discover about our clients or patients? Temperament from colour and texture. Absolutely. That links beautifully with something that I'm going to talk about today. I hope that you've all managed to get on the email that I sent, your discoloration chart, the progressive discoloration chart of the Oracle. We're going to be using that. Long-standing pain, yeah, congestion, lymph drainage, whether they are stressed or not, whether the areas feel hard or soft. Absolutely. So you're doing this already. You're already gleaning information about the patient's health from experience, from touching, from seeing the responses of patients, from looking at colour, from looking at texture. Chronic long-term health problems, Nunu, as well. Absolutely. Thank you. So this is kind of a similar thing, really. we're using the ears to gain an insight about the health of our patients. So I'm going to ask you a second question, if you wouldn't mind sharing in the chat. What client issues do we struggle to support effectively as therapists assigned to help our clients? So we always, as therapists, do what we can to help, but sometimes we have clients whose issues that we struggle to understand, we struggle to work out. We may know about their diagnosis, but we may struggle to have too much of an impact on helping them. I know that's certainly been the case for me with fibromyalgia patients. I've found that I have to really change the way that I treat using auricular therapy because their systems are so oversensitized. Clients are not always giving us all the information. Absolutely, Jackie. And sometimes in the consultation as well, you can ask them a question, are you on any medication? And they say no. And then when you start treating, they'll tell you about the medication they're on for their heart or their high blood pressure, or sometimes some really serious conditions. And you're like, I've just asked you that. It's absolutely. So they're not always giving us the information. Sometimes they don't know what is wrong with them. Absolutely. And what this does, what auricular therapy does, and visual inspection in particular, and tender testing, which I'm going to introduce you to, it can take some of the guesswork out of that. Because I have a little mantra, Jackie, that says the ears don't lie. And again, we're not diagnosing, we're interpreting, we're getting indications from the ears. But you're absolutely right. They don't always know what's wrong with them. And this is what, for me, is the astonishing thing about visual inspection of the ears. You don't necessarily have to know the patient's medical history. Of course, as therapists, we like to know because of contraindications and red flags, but you don't necessarily have to know because the ears will tell you. Thank you. That was really insightful. Another way of gleaning information, as well as the tender testing and the visual inspection, is we sometimes palpate on the ears as well, so we can use probes or golf tees even, and we can look at the response of the patients, and they can have a grimace on their face when points are painful. And it's the sensitive, painful points that are the most active, and they're the ones that really are showing us that there is dysfunction. Thank you. Thanks for sharing that. Okay, so this is an image of my ears. Well, it's my one ear, actually, it's my right ear. So as Dr. Li Chun Huang said, our ears are record keepers of our medical files, past, present, and future. So I'm going to show you a little bit about how my medical file can be found on my ear simply through looking at the ear visual inspection. It's easier if I talk you through it. So if we look at the blue circles, that shows my past medical history. I've undergone organ removal of my gallbladder and my appendix. And what you can see in these circles, I hope that you can see them really clearly, is at the exact point that corresponds to the gallbladder point and the appendix point, and where the bile duct comes down on the ear is a white scar. And more than that, an indentation. So Huang teaches us where an organ has been removed, we can actually see on the ear a little depression, a little indentation. But you can actually see the white scarring on the ear, and these scars match, obviously, the scars on my abdomen from where I've had my gallbladder and appendix out. Don't you think that's pretty astonishing? So the pattern that's laid out here would follow Nourgier's inverted fetus pattern, which I'm going to introduce to you on the next slide. So that indicates some of my past medical file. So 2013, I had my gallbladder out. I had my appendix removed in 2023. And then recently in April 25, I no longer got a gallbladder, but I actually had 15 15 gallstones removed from my bile duct that were stuck there. And you can see that the scarring actually comes down onto the bile duct as well. If we move on to my present health, that is indicated on my ear, which is in the green square, you can see, although you can't actually see it that clearly on this picture of my ear, but it's so clear on lots of other ones I could show you. Around the Shenmen point at the hip, the Shenmen point is in the triangular fossa, very near to where that green square is. I've got some very linear broken blood vessels. These are really typically seen in places like hips and knees. That's where they are represented on the ear near the Shenmen. We've got slightly different maps. We've got a Chinese map and we've got a Western map. So my present health, I have hip dysplasia, and we can really clearly see, although not majorly clearly on this picture, these broken blood vessels. We get them as long linear lines, and they will come off the points of the hips and the knees and the ankles. And then my future health, I've put a question mark, a red question mark. Can you see right next to it, there's a very large patch of white discoloration. Now, if you want to have a little look at your chart that I sent you, the progressive discoloration of the Auricular chart, you'll see that white is on there. And the area anatomically that this relates to, if we use Naugier's map of the body, the inverted fetus map, is the lung area, upper and lower lung. It's quite a large area that is actually white on my ear. Now, I don't have any breathing difficulties as far as I know. I think, Jackie, you were saying you don't always know what's wrong with our patients. I don't know that I've got anything wrong with my lungs. I'm asymptomatic, but my ear is quite clearly telling me that there is something going on. Now, what's really interesting is I checked on a different chart. That's the chart of Dr. Barr, who follows a German system. We've got French system, we've got German system, and we've got a Chinese system. And according to Dr. Barr's chart, where this white discoloration is in my lung area, he calls this the liver center. So that actually really links, doesn't it, with my hepatic system and the issues that I'm having there. So it's absolutely fascinating idea that our medical history, our medical file is on our ears. And often we get anomalies or skin alterations on the ears that can show up first on the ear before pathologizing within the body. So they can give us a really early indication of what's going on. And it really is only an indication. So I hope you share me in feeling quite astonished by that. So here is an early drawing of Paul Naugier's inverted fetus map. So if you're not familiar with auricular therapy or auricular acupuncture, this is how anatomically all of the points are laid out. This is only according to this one map. As I've already said, like in reflexology, you can get some different maps. I'm just going to grab my model ear here. So Paul Naugier was a French physician. He was a neurologist, and he actually propelled the history of modern European auricular therapy away from traditional Chinese perspective, following his discovery of what's called cauterization or burn marks on patients' ears. He was spotting just about here on the ear, which represents the lumbar 5 sacral 1 point, because the anti-helix is our spine, represents our spine. He was discovering these scars, and he asked all the patients, how have you come to have this scar? Because they all had it in the same place. And they all said that they had been treated by a lay person called Madame Berin, who was a French lady. And she had treated all of them for sciatica, and she'd actually burnt their ear at this point. I was just looking for my little paperclip, which isn't there. So it was from this understanding that Paul Nourget actually figured out the rest of the map, which is widely used today. So he figured out that if this is the spine here, so this is the bottom of the spine, then this must be here, the beginning of the spine. So we have the cervical spine going into the thoracic, lumbar, and sacral at the end. And that's how he figures out all the map. And when you look at this image, it's quite clear, isn't it? You can actually really see it. So here, on the earlobe or the lobule is the face and the head. Here on the antitragus, that's where we have all the brain points. I don't know if you can see that there. Really important limbic system. As I've already mentioned, we've got the spine points going around here. So the bony protrusion here on the ear is the spine, and then either side it run the muscles. Up here in the triangular fossa is the pelvis area. So we've got our reproductive organs, except the ovaries, which are found elsewhere. So this is our lower extremity here, so our lower leg. So this is where you find your hip, your knee, your ankle, your sole, and your toes. And then our arm comes down in the scaphoid fossa here. And remember, everything is upside down, it is inverted. So we have our clavicle and our shoulder, our arm coming up to our wrist and our fingers. So you can kind of figure it all out based on this map. So remember that auricular therapy and auricular acupuncture is not new. It's been around for about 3,000 years, but Paul Nourget's map just took a divergence because up to this point there hadn't actually been an organised anatomical map in this way. So what we can do as well is we can actually check out on the ear when we see ear anomalies, skin alterations. Using our probe, we can actually press on areas to palpate. This is called palpating, to see what's tender, what's sensitive, and those are usually the most active points on the ears, and those are the ones that we like to treat. I'd like to know your thoughts on ear piecing. Yes, absolutely. I can give you those thoughts, Jackie. Okay. So this is an image of cauterization. The point that I mentioned here, which is the lumbar 5, sacral 2, just off the edge of the antihelix here. And this is actually an image of cauterization, which was administered by Raphael Nourget, who is the son of Paul Nourget and still practices today. And what he actually uses, the best surgical equipment in the world, he uses a red hot paper clip to cauterize the ear. He leaves it on for about a second. It burns through the skin, but not the cartilage. And there's lots of research and documentation that it actually, when it's done properly, he uses light stimulation to find the most accurate acupoint on the patient. It's supposed to be extremely effective. So this is very much practiced today. So you should all have received your Microsystems Therapies and Training Progressive Discoloration of the Auricle Indications chart, which I've mentioned already. As I've uploaded these slides this evening to Google Classroom, as you can see, for some reason, the wording hasn't gone over. So I can only apologise about that. But I did all email it out to you, so hopefully you do have a copy in front of you. So I'd like to tell you a little bit about my checkered career trajectory of the last 25 years, with a focus, not about to just give you my CV for no reason, with a focus on how I came to understand and interpret the meanings and indications for mental and physical health through the visual inspection on the ears, and thousands of auricular therapy and auricular acupuncture treatments, which I've delivered with powerful and pretty astonishing effects. So what I really want to get across to you this evening is that you get a sense of those little moments of magic that take place when exchanging in ear talk with the ears, and how they will never let you down in telling you what is happening in the patient's system and their mood states. Must stress again, however, we are not being diagnostic here. But one thing I have learned to be true is that the ears don't lie. I told you that mantra at the beginning, and I stand by it. So I'd especially like to share with you some stories of the patients that I have met who have taught me the most about auricular therapy and life, alongside some of the worldwide eminent teachers that I've been lucky enough to be trained by. So these include Terry Olson, John Bake, John Tyndall of Yuan Clinic, John and Rachel Peckham of NADA GB, Dave Maybe of the Canadian Institute of Auricular Medicine, and most voraciously, I've studied the wisdom of Marcus Romoli and Dr. Li Chun Huang. She is known as the mother of auricular medicine. In relation to what Olson calls and what they call auricular diagnosis, I don't use the term diagnosis, I call it ear assessment. So I first trained in reflexology and aromatherapy in 1999. I'm accredited with the Association of Reflexologists and also the CNHC I'm registered with. But quite early into my reflexology career, I had a chance meeting with somebody who asked me if I would be willing to work with young people in a Birmingham-based substance misuse service. Now, I didn't know anything about supporting adolescents with drugs or alcohol. In fact, I was very interested at the time of working with people with eating disorders. But since that wasn't on the cards, I decided to give drugs and alcohol a go instead. I became lead complementary therapist at Birmingham's only young person drug treatment service at the time, which was called Birmingham Higher Holistic Innovative Approaches to Health. And this service was really unusual because it was highly innovative and also very integrative, focusing on holistic treatments equally, if not more, than medicalized model for opiate users. And it really supported the needs of stimulant users via complementary therapy. And of course, talking therapies, I'm not discounting those. I loved working with young people and being able to use my essential oils and reflexology to help them relax, and they loved it too. In 2002, Hire commissioned John Tyndall of Yuan Clinic to train us in Birmingham in a worldwide auricular acupuncture protocol called NADA. That stands for National Acupuncture Detoxification Association, bit of a mouthful. So John had learned the protocol with Dr. Michael Smith. You can see a picture of him there at the Lincoln Recovery Center in the Bronx, New York, and auricular acupuncture there, just a really simple 5-point protocol, was used daily to support methadone detoxification at the hospital. So learning this really simple 5-point protocol had a profound effect on me, as I witnessed the impact of the treatment had on those receiving auricular acupuncture. Not only did I begin to notice the weird and wonderful differences of people's ears, complete with nodules and papules and upturned earlobes and double tracheases and creases and wrinkles, I really became struck by the speed at which people relaxed. They had a better night's sleep, they had clearer skin, they had less pain, they had clearer minds, and they had much more balanced states. They not only began to look better, but they told me that they felt better. And it is witnessing this fast-acting change in people that continues to propel my desire to spread auricular therapy in my treatments and teaching. And I'd like to just draw your attention to a moment to a quote from Dr. Michael Smith that really sums up how he says it supports us not only physiologically, but spiritually too. So he says, and because acupuncture can take the most panicked person and show them a peaceful side of themselves in about 30 seconds, and I can vouch for that, you are able to reveal this important human and spiritual lesson right away. There's nothing in the needle, so there must be something good in me. Something good, something peaceful, something quiet, something forgiving, and something optimistic. And auricular therapy really does raise the spirits of people and puts them into a quiet, silent place of healing. So during my time at Birmingham Higher, we were trained in psychosocial interventions of the moment, going back to the early 2000s, probably late 1990s. That was motivational interviewing, solution-focused therapy, and another talking therapy approaches, which were a fantastic accompaniment to relaxation therapies and still are. The reflexology and aromatherapy were really effective at supporting young people, but when I added the treatment modality of auricular acupuncture, it was a game changer. I want to tell you about one young person I met called Joshua. That's not his real name, because he stays in my mind, not only because I was really fond of him over the years that I got to know him, but he used to make me smile. He would come in without fail for auricular acupuncture treatments about 3 to 4 times a week with his imaginary dog, who he would whistle and call. Joshua liked to set fire to things, and since he had set fire to the curtains in his home, he had been moved into care. In a deeply relaxed state, he once nonchalantly asked me, "Do you ever think about setting your hair on fire?" Of course, I hid my surprise and gently told him that I hadn't. Joshua clearly had some mental health issues and was trauma experienced. But the trust that he handed to me to experience positive touch was humbling. If we take a look at the slide, we can see Joshua's profile on paper was not the Joshua I saw when he was deeply relaxed and calm during and after his treatments. His ears told me what was really going on with him. So on paper, Joshua's profile said he was age 14, he was an arsonist, he was in the care system, he liked to use amphetamines and cannabis, he had an imaginary dog, and he presented very restless, pacing, fast pressured. Jackie, you can see the slides on the screen, can't you? Hopefully. But the Joshua's ears said something different. They said, "I have experienced trauma. I am dysregulated. I experience high moods, then crashes." If we look at the skin alterations on and around the antitragus, the brainstem, the occiput, the hippocampus, and the amygdala on the ears, all in these areas here. Here's the earlobe, here's the antitragus here. Then we can detect mood disorders, and this is what I saw in Joshua's ears. What I also saw in Joshua's ears was my autonomic nervous system is out of balance and my parasympathetic nervous system requires activating. My system is depleted and it's also showing lots of heat. So Joshua's ears might have looked something like this. If you use your progressive discoloration chart of the Oracle, hopefully you have that to hand. If you look at that photo of Joshua's ears, what is the first thing that you notice about his ears? If we look for colour, we mentioned colour and texture, didn't we, right at the beginning, as gleaning information about our clients. What do we notice about the colour? Very red. Thank you, Lou. Absolutely. What kind of red? How would we describe that red? Where is it on your chart? Oh, good, Jackie's back. Where is it on your chart? What kind of red hue are we looking at? Yeah, the helix, Nunu, is absolutely very red. And within the helix, also within the scaphoid fossa here. But the colour hue is acute, isn't it? It's acute red. And we know that because it's bright red. And that's on your chart at the bottom. When we see the colour bright red on the ears, we know that the inflammation in the system, the heat that's in the system, and probably pain that's in the system. This picture of this person's ears, it's not actually Joshua's ears because I didn't even have a phone back then. or to take photos, but this person's ears really does show that they've got inflammation, they're in pain. Whenever we see the scaphoid fossa here, whenever we see bright red here, it shows this inflammation in the system. This person's probably highly stressed. He's also got dysfunction in the lung area. The lung area is here. I showed it you on myself, didn't you, on my own ears. We can see that's really red. It's the same kind of colour. It's really bright red. It's quite acute. That's it with baby's teething. Beautiful analogy. Yeah, their little cheeks go bright red, don't they? Thank you. So what we also notice around the antitragus here, we notice on this picture, we've got this protrusion. We've got this area here on the ear that's raised, and this is really typical of what you see in people with mood disorders. And often in mood disorders, you see this red come down here towards the earlobe, and you're seeing that on the photo of Josh's ears as well, aren't you? What else do we detect on the anti-helix, which depicts the spine area? We have got this bright red acute colour that's going just outside of it, as Nunu said, onto the helix and got into the scaphoid fossa. What do we notice about the colour just here? Going kind of from the cervical spine onto the thoracic spine. It kind of ends about there, doesn't it? What colour is it? Answers in the chat. It's definitely paler in colour, isn't it? Thank you. What colour does it look like to you? Is it red or is it a different colour? Any ideas? I don't know about to you, but to me, yeah, it does look a bit grey. It looks brown. Looks brown to me. So what I wanted to show you is when we're talking about what we can tell from our patients from the different colours and the different hues, brown means chronic healing. So he's got these acute areas of inflammation whereby the inflammation is happening now. The brown shows that he used to have a problem here on this part of the spine, but it's actually begun to heal. So we can tell an awful lot just in one picture, can't we? We've also got a crease just beyond the occipital here. This is really typical of people with mood disorders, headaches, people I find who've got a really foggy brain. Have a look at their little occiput here, but what we're seeing here is creases here. And Romoli shows us in his depiction of for depression and insomnia on the slide that we get in this area incisures. They're like little marks, little linear marks, cuts. We get creases, depressed areas, red areas, indentations. These are all really typical of mood disorders. So do have a look at people's ears and see if you can spot that. So I want to introduce you to an analogy. This isn't my analogy. This is one that Olson talks about and Raphael Norgier talks about too. And it's the analogy of the ear as a computer terminal. And this partly explains what was going on for Joshua. If we imagine that the ear is a computer screen where we see what Olson calls diagnostic signals on the external ear visually. And we're not going to call them diagnostic signals. We're going to just call them skin alterations or manifestations. And when we type a message using the keys on the keyboard, in other words, we might palpate using a probe or using a golf tee or using our fingers or using needles or even a pen with the ink taken out. What happens is, or even electrical stimulation, we are sending a signal to the brain via the central nervous system and, according to Raphael Norgier, through the auricular microhormonal system as well, to enable us to treat pain, functional disorders, addictive disorders, problems, and minor psychiatric disorders, according to Raphael Norchier. So indeed, extensive research has gone into the efficacy of NADA protocol, which I introduced you to, and it's now gone well beyond detoxification of methadone and addiction. So I can introduce you to people like Beverly DeVloy, who has done a lot of research in NADA with cancer care. She's actually just rewritten the acupuncture guidelines as well for cancer care. If you go onto the NADA GP website, you can see her articles on there. We also have Kaiser Landgren, and she has done a lot of research about NADA for mental health and eating disorders as well. So Kaiser is really interesting. She's recently done some research also with Du Van Hoffman, particularly on the vagus nerve. So these are people who have dedicated themselves to the research on auricular therapy. You know, they're not only nurses as Kaiser, body acupuncturists as Beverly, but they're professors too. So they're practitioners as well as researchers. So if you do have a look on the NADA GP website, you'll be able to see Kaiser's work on there as well. And both of their work was actually taken place in hospital settings, which is really interesting. And that's usually down to funding, where you can get the big funding for those clinical trials. So I moved to adult drug and alcohol treatment services, and I worked for the NHS, for Birmingham Solihull Mental Health Trust. And I worked as a specialist drug and alcohol treatment practitioner in criminal justice, so working with people using Class A drugs and alcohol, actually, and most of them were offending, usually to actually fund their drug use. I was lucky enough to get some really good training, and I trained in psychosocial interventions, including cognitive behavioural approaches. I provided a Birmingham-wide auricular acupuncture service to support hepatitis C and HIV positive patients. I also treated the commissioner alongside the patients. Auricular therapy is a really equalising and levelling treatment, and I offered the commissioner condoms too, just like the other patients. Patients that I saw were entrenched in multiple services spanning many decades, and they were required to tell their personal stories and trauma histories over and over again. Their function of use was mostly always to mask their emotional pain and trauma. They became another case number, and the search for the good person, as Michael Smith told us, became forgotten and invisible. But here came the magic of auricular therapy. Auricular therapy makes no demands on people. There are no demands to talk, to retell their story. It's a non-verbal treatment that does not require the removal of clothing either, only a private silence, balance of bodies and minds, as our patients are triggered through auricular therapy to regain their homeostasis, because that's what auricular acupuncture does. It will always try to get the patient's body to a point of back to balance and homeostasis. I used to use seeds a lot as part of auricular therapy, and these were a lifeline for stimulant users, particularly crack users, who presented at the service without the requirement of a medical model, such as opiate prescribing substitutes. And they presented irritable, agitated, restless, and had a concentration level of about 15 minutes. And I used to love working with crack users because I knew about the fast-acting nature of auricular therapy and how it would make such a difference to them. So I want to introduce you to one particular crack user, Paul. Paul is not his real name again, and I came across him within the drug intervention program, which was very well funded then for Class A criminal justice users support. He told me about the difficulty that he was having reducing his crack use and the cravings. He tried to help me understand what a grip crack had on him. He said to me, take your best orgasm and times it by 100. That is what crack is like. Now, how could I compete with this just with auricular therapy? But I set to work. What I saw on his ear and many ears like him was yang rising, heat in the system. We can also treat on an emotional level as well as a physiological and neurological level. And often what you see is frustration and anger when you treat patients who are using crack. So yang rising, as we call it, would be seen as this heat, this red, this inflammation in his system. His shenmen, which is this part of the ear here, shenmen means gateway to the spirit, which is a really, really calming point. It's a wonderful place to proceed or to palpate. His shenmen showed me a lack of calm. His liver showed me that it was compromised, possibly linked to the emotion of anger on an emotional level. That's what the liver is linked to. And his stomach and digestive systems were impaired, often constipated. So what's wonderful is the simplicity of finding the digestive system on the ear. So remember, everything's inverted, it's all upside down. So we've got the tragus here. Tragus actually means hairy part of the ear, so you'll be able to remember that. And our upper digestive system actually starts here in the lower concha. So you've got your mouth going along to esophagus, trachea, and then it follows a U shape around this helical ridge. So then we come to stomach here, then we come to small intestine, large intestine, right the way through to anus here. So do have a look at this helical ridge on people and notice anomalies on there. You might find lots of red patches with pale parts as well, often together. You might find pinpricks of redness. You might find purples, raised parts. So do have a look on this digestive area. It will tell you a lot. And it's such a simplistic way of remembering in a U shape. What you're seeing in this photo here is a very long linear telangiectasia, which cuts across Paul's stomach, starting here where the helical ridge flats out, all the way across. It travels to his liver here. Remember that the liver is an organ, so it will be represented as an area on the ear as opposed to a single point. Look how clear that is on Paul's picture. Now this picture is actually taken from somebody misusing subs prolifically and long term, and he's suffering from digestive issues, and his liver is very much compromised. It's very clear to see on that picture as a result of his drug use and a depleted system. I couldn't quite compete with the euphoric effects of crack that Paul craved, but I did come a close second. Using auricular therapy, he described to me this is how it made him feel. He said he gained a sense of calm and release. He felt better, he had a better night's sleep, he had clarity of mind, he had reduced cravings without substances for the first time in decades. And of course, he came for regular treatments. And I distinctly remember this quote that he said to me: I feel like I've eaten a space cake without eating a space cake. That's a genuine quote, which he said to me. For what we know was happening to Paul is what Muriel Agnes describes auricular medicine to be, as a window to the brain. So auricular therapy, visual inspection of the ear, is a gateway to the whole brain happenings, she says, that makes structures and functions of the person visible. And if they are visible on the ear, just like a footprint in the sand, or Olson's diagnostic signals description, then we can not only read them, but we can gain feedback from the ear by palpation and tender testing to inform us exactly where on the ear we need to treat efficiently, accurately, and effectively, to access neural pathways and change the deep regions of the brain and ultimately change the health status of our patients. Romoli et al. Has shown us that this is the case with their functional MRI scans. So imagine knowing that you can change the emotional, physical, neuromodulation structures of the brain, we can access the deep regions of the brain through the nerves just by palpating areas of dysfunction that have been shown to us on the ears. What would that do for you in your treatments, in your reflexology, in your massage, in your Indian massage, in your crystal therapy, when you're trying to figure out what is going on? What difference does that make to you now, knowing that you can actually change the brain chemistry and brain structures through auricular therapy? Please just pop your answers in the chat for me, because this is the process that I call ear talk, where we see these imprints on the ears. Anybody? Answers in the chat? Okay. It is mind-blowing, Jackie. It is mind-blowing. Hi, Hazel. Hope you're okay. It is absolutely mind-blowing. The fact that our ears, just by visual inspection, are a window to the brain. And what's really mind-blowing is it is backed up. We have the evidence from Romoli. It is amazing, Leslie. We have the evidence from Romoli et al. So, could somebody just, thank you, if we could just mute our microphone. So here is a functional MRI scan of some research that Romoli et al. Did. And what they did was they stimulated on the ear 2 points. They stimulated brainstem down here and the thumb point up here. And they looked at the relationship between when they stimulate the ear with a needle, or indeed the sorts of research where even just ear seeds or palpation, what the response is in the brain. And what Romoli et al. Really clearly showed is that there is this brain-body connection. And he showed that it is specifically the parts of the ear that we are stimulating that is affected within the brain. So it isn't the case that we can just stick a needle anywhere or we can palpate anywhere and it might do some good. What we absolutely know is it is the point-for-point correspondence on the ear that is being tested affects those parts of the brain regions that are implicated in functioning those body parts, for example. So the motor system to do with the thumb area of the brain was lit. But so I like to think of the ear as nature's functional MRI scanner, because we can peek, as Muriel Agnes says, a window to the brain, and we can look into the brain and just by knowing that those areas that are showing of dysfunction by the skin alterations on the ear are actually point for point affecting those same regions of the brain. And what's really interesting is here, it's not only that those certain areas of the brain are activated and lit up, but also different parts can be deactivated. So in the case of pain, we know that the message that goes to the brain, I feel pain, doesn't get through when we use acupuncture and auricular acupuncture and seeds and body acupuncture, of course, and palpation. And this is something that Dave Maybe from the Canadian Institute of Auricular Medicine talks about. I've trained with Dave Maybe on trauma. He's got a wonderful auricular trauma release program. And he talks about how when we stimulate the different parts of the ear, we are stimulating and accessing the nerves, particularly the vagus nerve, that what happens is the brain becomes reorganized. So we're effectively facilitating neuromodulation, and Dave talks about on an energetic level that we are removing blockages. So have a think to yourself about which patients you know that might make a difference to, how we can effectively access their vagus nerve and bring about relaxation and neuromodulation. I can see some of the messages in the chat. I will come back to you, I promise. So Bessel van der Kolk here, he talks about the need for somatic therapies and relaxation therapies, like the therapies that we all do, in place of higher thinking talking therapies at certain times of people's trauma response. Now, I'm not suggesting there's not a place for talking therapies to support people with trauma, but the timing based on where they are in their trauma response, such as frozen states, is really important. And what's interests me mostly about his book and also the webinar series that I've been following, he says that trauma lives in the body. And he actually talks about toning the vagus nerve and different ways to do it. So in terms of treating trauma, he says it's not about talking. It's about activating your system. When you're frozen, you're shut off awareness of your bodily states. And basically what you need to do is get the body to be alive and to reinstate the signals between the body and the brain. Exactly what Romoli has just shown us happens between the body and the brain. You can do this by singing, breathing, making sounds. So these are all ways of toning the vagus nerve, and we can do this by auricular therapy. So we can access the vagus nerve, which actually innervates and comes into our ear here at the tragus, and it goes all the way along the concha. It does overlap actually with some of the other nerves. It's not quite that blunt, that they're in chunks and they don't overlap. But we know predominantly that the vagus nerve comes here into the tragus and innervates over the concha. And we're so lucky as auricular therapists, because the external ear, or the auricle, is one of the only places on the ear where the vagus nerve innervates just under the surface of the skin. There are actually 3 points for the vagus nerve on the ear where we can stimulate if we want to be really precise and accurate. Or if we're less concerned about being really precise, we know that any time we stimulate the concha in here, upper and lower, we are activating the vagus nerve, which is activating our parasympathetic nervous system. Our parasympathetic nervous system carries our afferent nerves. 90% of the parasympathetic nerves are carried by the vagus nerve. So anytime you stick a finger here, we can do ear massage or ear reflexology, or palpate here. We can use our finger and thumb, or stick a needle or a golf tee or a pen. We can actually bring about relaxation for our patients by activating the vagus nerve through the parasympathetic nervous system. Shall we have a little go very quickly together of activating our parasympathetic nervous system? Oh, vagal nerve stimulation is the only treatment that's helped you, Hazel, for long COVID. Amazing. Yes, you can get an electrode. Is this what you're talking about here on the tragus? It can come onto here, can't it, to stimulate the vagal nerve? People can also get it here in the clavicle. They can get implants to tone the vagus nerve here as well. But we can do it without technology, without scanners and stimulators, just with our fingers. So I'd like us all to just take a moment to share and just do some nice circles in the concha, in the upper and the lower concha, and just bring yourself into a little state of relaxation by activating the vagus nerve and the parasympathetic nervous system. You can also, remember, treat the back of the ear as well with the thumb and the finger. So we can treat the ear anterior and posterior. We can press. See if you can find within your concha, where are the most sensitive points you can press with your ears. The fingers are quite large for such a small surface area on the ears. Of course, it depends how large your ears are. Our ears actually never stop growing. So elderly people, particularly men, tend to have much larger surface area on their ears. So they are ideal to treat with auricular therapy because their points are just so clear. How are we feeling? Do we feel as though we have stimulated our vagus nerve? Do we feel nice? If you're laughing, yeah. But gosh, you know, it's so fast acting. You can really, really feel it. It's not made up, is it? You can really feel just through massaging and pressing, doing some ear reflexology, the effect of that on our ears. So I left my NHS specialist substance misuse. Jackie, yours was a little bit painful. Absolutely. So the painful points are the ones that are out of balance. The ones that are out of balance are usually the most active and indicate to us areas of dysfunction. So make a note of that. On my workshop, Jackie, I have a transcribing grid where you can actually draw in a very, very precise way where those sensitive parts are on the ear. And I also offer on my workshop a tender testing grid and chart as well, where you can actually use the Likert scale to find the scoring of the tender testing and link that to the anomalies and the positioning on the ear as to where that point of dysfunction is found, using Nourgier's anatomical map to work out what's going on in which part of the system. That's online, Jackie. It's 2 days online. So I left my NHS specialist substance misuse worker role when the voluntary sector took over, but I continued practicing my therapies domiciliary in a small local clinic. I continued CPD in auricular acupuncture and treated a much wider range of conditions. So I was coming across ears now, the weird and wonderful, and noticing things on them with musculoskeletal pain, fibromyalgia, ME, migraines, headaches, joint pain in particular. You just take a look at the triangular fossa here and the hip point here and the knee point here. You will see these linear lines along there, these dilated blood vessels that show us that they've got a dysfunction in hips and knees and ankles and the joints. Really easy to spot. I became particularly interested in women's health as I carried on with my CPD and immersed myself in reflexology CPD, including maternity reflexology with Sally Earlham, and reflexology for women's health with Hager Basis. I attended webinars with Barbara Scott on supporting fertility. Obviously, this was all using the feet, not the ears. I attended advanced reflexology workshops with Tony Porter and studied reflexology for pain with Carol Samuel. And I drew parallels from the reflex areas and markings that could be found on the feet to the ears. And I noticed some really interesting patterns. In terms of women's health, in particular, and hormonal imbalance, we spoke about that at the beginning, didn't we, in the chat? We can see that there is dysfunction in people with fertility issues or hormonal imbalances or reproductive issues. So patients that were coming to me, and I knew that they had certain diagnoses of polycystic ovary syndrome, of endometriosis, of dysmenorrhea, of adenomyosis. When I looked at the ears, I was noticing that there was a very clear pattern in two areas on the ears. Here, this is called the intertracheal notch, and the endocrine area, and it is an area, although we have this point, acupoint here, I want you to try and notice in this area here, this is where our master endocrine point is, or our master pituitary point would be. If you have a look at the photo that's on the left, you can see where it's got the blue circle round it, at the bottom here, where you've got the orange needle sticking out. Can you see how red and acute that is? That tells us that there's some inflammation in the system, that there's heat in the system, that there's dysfunction. And the area that relates to is the endocrine system. Equally, you will notice that there's some needles, the orange needles, which are what we use in auricular acupuncture, are here within the pelvic area. This is where we look to for gynae problems, gynae issues, and where we can treat. And I've treated here her uterus and her cervix point. I've actually used the ear as a guide, and I will go where I see anomalies on the ear. If you look at the other picture in the triangular fossa here, what you notice is a slightly different color. If you refer to your discoloration chart, you'll see it's not as bright and red acute as this one down here. It's a little bit more purple, and that indicates blood stasis, stagnant blood. Blood is not flowing properly. Take a look at all the pale areas on that same ear against corresponding to the brighter red, more inflamed areas here on the helix, on the antihelix. And we've got these bumps and lumps. It's not smooth, is it, within the triangular fossa? This tells us something is going on, and we know something is going on because the person told me that they had polycystic ovary syndrome. Do you find that interesting? Isn't that fascinating? And that's something that's so accessible to you, just to look at those two areas on the ear in the triangular fossa and here in the master endocrine point. Interesting actually to look at clients who are pregnant as well and what's showing there, just like we do on the feet, where we look at the spine and look at the pelvis as well. So, as I've already mentioned, you've already got your progressive discoloration of the auricle indications chart, so you can have a look at that to refer to when you're looking at those areas on people's ears. So 8 years ago, I took a divergence from my roles that I'd done up to this point, and I went to train as a secondary school teacher. And then I trained as a specialist social and emotional mental health teacher with Birmingham University. So this meant that I continued to mainly work with dysregulated young people within a mainstream education system. And the students that I was working with mainly had neurodivergence and special education needs that struggled to fit into the mainstream education systems. My responsibility was looking after the children who were looked after children. They were young carers, and they were previously adopted from care. So although I was not able to directly use auricular therapy or auricular acupuncture in an education setting, although how much I would have loved to, because I've known how much it would have helped, I was able to use my experience of cognitive behavior approaches and somatic approaches like mindfulness and breath work to help students become regulated. But I did used to teach them reflexology and hand reflexology. And what I continue to see on these young people, on their ears, was visual signs of anxiety and emotional dysregulation, in particular around the brain and the head areas. What's so fascinating is we can actually directly access the HPA axes, the hypothalamus, pituitary, adrenal axes, really precisely on the ear, because we know where those points are. So the first chart that I show you that's got the reference to Dr. Barr's chart, the circles that you can see, the first largest circle is the adrenal point here in the tragus. And depending on which chart you look at, it's quite high here on the bar chart. It can be much lower according to some Chinese charts. We see there's a point here for the pituitary, and the hypothalamus point is actually tucked behind you. You actually have to pull down the antitragus to get access to the hypothalamus point. Look how precise we can be. We can actually access the HP axis precisely on the ear. And in addition, we can actually precisely access the limbic system. These are all places on the ears when you treat and look at people with anxiety, when they are dysregulated. This is what you will see on the ear. So these are the parts that I want you to go for, to look for the anomalies and to treat. So we have got our limbic system here on the Dr. Beat Streetmaster, who follows the German system as Dave Maybe does. And you will see that here. Dave Maybe does also follow the French system and uses the FAS as well. So nice, neatly lined up here, just under the antitragus. When this is also the headache line. If you have a look at people who tell you that they've got a headache, they tell you they've got a migraine, just get them to use their thumb and finger and just rub here, or apply a seed, or apply a magnet, or palpate. And you will often hear that they'll say their headache has dissipated. So what you will notice here, which is the center picture in particular, of this protrusion, this puffy area around here, around this antitragus area, and the redness around there is often found with people who are dysregulated or have anxiety. You will often see creases there as well, and particularly around the brainstem area, you'll see a redness too. You'll often see broken blood vessels as well in the concha and on here around the shemen. And you often find when people are in emotional distress, or that their systems are really burnt out, that when you needle the shemen, it bleeds when you take the needle out. So what we are echoing here is what Dr. Li Chun Huang tells us. And she says, it is as if the ear can speak for and express itself. And that's actually the line that gave me the idea to call my workshop Attuning to Ear Talk. She's known as the mother of auricular medicine, just like Eunice Ingham is known as the mother of reflexology. And she says it is as though the ears can talk, just like I said at the beginning, if only we know how to listen and make sense of the stories that are being told to us by our ears. So on my online workshop, I actually teach you 7 different skin alterations of the auricle, and I use real ear photos, which have been curated from well over 2 decades. I'm very proud of my ear library and my ear gallery. And the way I teach you these 7 skin alterations is in a stepped, scaffolded framework. Some of the things we'll be doing as well is we can transcribe. I show you my transcribing grid, so you can look at what anomalies or skin alterations are on the ear and precisely draw them onto the grid and track them over time, because every time you look at the ear, it will change. Okay, so even if you're seeing clients week on, it will change. Every time you wipe the ear, actually the ear changes. So what's really important is before you touch the ear or photograph the ear, just make sure that you've noted on your transcribing grid or made a note in a narrative way where the anomalies are and what they are and the areas that they correspond to, because as soon as you wipe the ear, the structures change and it will look quite different. It is a fun workshop, and I also invite you to share pictures of your own ears and of those around you. And as a group, we can use those for ear assessment. And one of the things that I invite participants to do as well is I invite you to my experimental case study, which actually replicates some of the double-blind control trials of Romoli and Olsen, although unfortunately without the huge funding. So if anybody knows any access to funding where we could actually do a double-blind controlled trial in a much more clinical way, please do let me know, because I'd love to be able to do that. So you will learn the art and science of ear talk, and how we can interpret the language of the ears to indicate the health status of the patients. So I do have permission to share this slide. This is a lovely slide that shows so much of the laughter and the fun that we had. It's a little snapshot from the weekend where I ran my workshop. Here I am proudly displaying my Dr. Huang book, here it is. I'm particularly proud of this book, which has literally got hundreds of colour photos. I also share with you my own colour photos, as I've already mentioned. Yeah, it is online, as you did ask, Jackie, but it's more of a workshop than a course. You're very much part of that learning. It's about connecting. It's about sharing your experience and ideas, which is why I love working with therapists. You are my favourite kind of people. And coming together and being enlightened. I'm still enlightened myself. On that course, I won't mention the name of the person, but they'd sent me an image of their ears, because we did share each other's ears, and it had something really distinctive on there. 3 tiny little dots here on the earlobe that was slightly upturned, and they asked me what it meant, and I didn't know. So I researched it, ploughing through my books of Romoli, of Huang, of Olsen, and Googled various things. And what we came to discover was there was a link, because it was on the helix down here. The actual part of the helix that it was actually linked to deafness. And I didn't know that. I had to look that up. And when I fed that back to the person, thinking this is probably going to be a long shot, this is going to be a bit of a tenuous link, that person did actually say to me that they were 30% deaf in that ear. So the ears don't lie. And I am still amazed and astonished myself as to what the ears will tell us. And we don't always know what the ears are trying to tell us, but we can do our best to listen and learn and to gain insights from them. This is some practitioner feedback that Nunu, who's on the call with us today, gave. And Nunu is willing to answer any of your questions that you might have from a practitioner point of view as well. And he says, I attended the ear talk workshop with Anna to further solidify my knowledge on identifying certain health traits and conditions, and I cannot recommend it enough. Thank you, Nunu. It was informative, delivered to perfection, and it was mind-blowing to learn how certain skin conditions, previous history of health shows upon the ears. And I can reassure you that I'm not paying Nunu to say that. He has received his certificate, so he doesn't actually need to give me that wonderful feedback. So what I'd like to just introduce you to is the idea that I have come full circle. I've now actually left my education job. My frustration and disillusionment at the inept systems and lack of resources to support some of our most vulnerable children with special education needs has become too much for me. And since I left at Easter, a wonderful thing has happened. On the same week that I left, as I was feeling quite guilty about leaving the young people who I built up close relationships with and has supported through their trauma and attachment issues and their mental health difficulties, a mother made contact with me, and she asked me if I would support her daughter who had autism and, wouldn't you believe it, eating disorders. So I have kind of come full circle. The universe has appeared and sent me the beginning of eating disorder patients. And I must also add, I also treat the caregivers and the parents. And what I like to do is treat people together, young people and the parents and caregivers together. Because as I mentioned before, auricular therapy is a really equalizing treatment. There is no power dynamic. As I told you before, I treated the commissioners alongside HIV positive patients. And what you can see on this picture here is Woodbrook, and Woodbrook is where I now have my clinic. And this was on my 2-day face-to-face auricular acupuncture course where I was teaching people a protocol for stress and anxiety. And we went outside and enjoyed the grounds. It was a beautiful day, and we did some qigong on the grounds. Oh, Amanda, you remember me needling an ear point on the training, relaxation point? Absolutely. That was the course that I was training on. So where I am here at Woodbrook, and this is my clinic space in the room behind me, you can see my gorgeous original fireplace. It's a really special place. This was George Cadbury's former home. It's a very serene, tranquil setting for my face-to-face courses. And it has a real protective factor. It's a bit like entering a sanctuary. This place, Woodbrook, was actually in the hands of the Quakers for 120 years because George Cadbury gifted it to them. And you can really feel the effects of 120 years of Quaker prayer within the building. So it's a wonderful place to come to. And my clinic actually, and what I'm looking at now, overlooks the lake and the grounds. It actually overlooks those concentric circles where we were doing our qigong. So my next Attuning to Ear Talk workshop is on the 17th and 18th of July. It's live, as I've said, online, interactive. It's 2 days and it's FHT accredited because it's 16 hours. You'll get 16 CPD points. I know lots of you are linked to the FHT, and it's accessed on Google Meet, just as we're accessing now with the slides. And as a thank you to you for attending my webinar this evening, I'd like to offer you a 20% discount on the usual price of £280, bringing the cost down to £224. You will need to message me via my website inquiries page, just as many of you already did to express your interest in this webinar tonight. And just pop in the subject line code EarTalk20, and I will then send you a booking form and an invoice with the reduction on. The QR code that is there on the screen should take you straight to my webpage. So please do take a moment just to have your camera out, and it should take you straight to the website, which is www. It's very easy to remember, mtat.uk. Thank you, Louise. I'll be in touch with you very soon. Thank you. I do hope you can join us. So this code is valid for 14 days. So yeah, 14 days. Which takes us to the 4th of June. And I must stress that the workshop is exploratory. So it's very much about exploring together, learning together, and having a little bit of fun. And just finally, before I come to questions, I just wanted to share another couple of feedbacks with you. Dr. Kashmir Goddard, she's a systemic psychotherapist. She's an addictions counsellor. We met on a master's course, which we did, which was treatment of substance misuse with Dr. Red Day at Birmingham Uni. And she's also a local authority educator. She works with a lot of very dysregulated young people and head teachers. She said, this is such an amazing course. It was so informative. And I felt so privileged to be able to do this. What a brilliant teacher Anna is. She's so knowledgeable and runs the course at an excellent pace. So thank you for that, Kashmir. It's very kind of you. And Lucy Shears, who is a very experienced body acupuncturist. She says, I spent a wonderful weekend on the Ear Talk course, learning that our ears hold our medical records. You've learnt that tonight. And that the ears don't lie. It's been absolutely fascinating and so valuable. My confidence and knowledge has been boosted in the generous, supportive and fun learning space. created by Anna. I feel invigorated and excited to start putting what I've learned to good use. Thank you so much, Anna. Can't wait for the NADA course in June now. I'm running the NADA course twice, actually, one in June and one in July. One of that's over 2 weekends, and the other one in July is spread over just a 4-day block. So I hope that's been really helpful for you. I'll just put that back on the screen so that you can access the QR code, which takes you to my website. And then I'd love to come to questions. Thank you, Nuno, for putting the website link as well in the chat. I did notice that flash up. You've been a wonderful, very able assistant this evening on the chat. And please do ask me questions, and please do ask Nuno questions as well, as he's completed the workshop and he can give you a perspective from a practitioner. So I'm just going to pop along now. Thank you, Louise, to the chat. Have a little look about what's been happening, because I've been seeing bits follow up. Don't both ears tell the same story? No, they don't. Because if you think that when I introduce you to the image of my own ear, the gallbladder and the appendix are only found on the right side of the body. I only have that scar and indentation at where the gallbladder mark is and the appendix mark on my right ear. I don't have it on my left ear. What you'll also find is, so it tends to follow the pathology. So what's happening in the system and in the body, in that side, it will tend to pathologize on that ear. Of course, you can have some cross references, but both ears can look very different. And both ears are very different in their sensitization as well. You always have one ear that's a little bit more sensitive than the others. What's this, Jackie? I'd like to know your thoughts on ear piercings at the end. I knew someone that had a problem with their throat. Doctors could not find anything wrong, and it was really affecting her. She went to a chiropractor who was also Chinese and an acupuncturist, and he told her immediately what was wrong. It was a piercing through a point on the ear. So the throat point is going to be around here. If you imagine that we start here, the digestive system, the upper digestive system, our mouth point and our throat point are along here, the larynx and the pharynx. So what happens when an ear is pierced? Initially, you will find that it will activate the point at which it is pierced and the corresponding point that relates to, following the anatomical ear chart, but that fades over time. So what tends to happen is the active part of that point that was pierced will shift, and we actually get histological structural changes within the ear. So clearly for that person, there was some kind of issue, maybe a histological structural issue had formed in the throat area. Does it mean that the earlobes are really flat? Well, the earlobes aren't flat. They're they all come in different shapes and sizes, Leslie, don't they? Sometimes you can get some ears that are upturned. Sometimes in some conditions, particularly relating to the cardiovascular system and the heart, you can really see that the ear thickens, and you can see that in patients with heart attacks as well. And you can see protrusions and raised areas become apparent on the ear, particularly, as I was telling you, around the antitragus part when we see the mood disorders. I hope that answers your question. Thought-provoking stuff, thank you. Is there anything I've missed? Oh, Amanda, I remember you needling an ear point on the training course, just one relaxation point, which is high in the ear and the superior line of the triangular fossa, and you agreed it was instant. It is. That point is very powerful. People feel that really quickly. Another point that people feel really, really quickly, and I teach this on my stress and anxiety course, is point 0, which is here in the helical ridge And anatomically, this is where the umbilical cord would rise out of the abdomen. So it's a bit like the solar plexus. It's the center of everything and brings everything back together. When you needle that point, you feel it really quickly. And sometimes when I used to needle people using stimulants, cocaine and crack, often they were really sensitized. And remember, you've only got them for about 15, 20 minutes. I just used to pop a needle into 0.0 and Shenmen here. Shenmen means gateway to the spirit. It's a really calming point. And that was enough, just those 2 points together. And it whoosh, the system just calms down really quickly. It's absolutely fantastic to watch. I hope that's a useful little tip for you as well. Is there anything else that I've missed? I'm trying to scroll up and see. Thank you for that, Amanda. Somebody can feel quite a dip in yours. What can you feel a dip in? We were talking about the triangular fossa at the time. You can fit your little finger in. Where you've had a total hysterectomy, Jackie. That is mind-blowing, isn't it? So you've got an indentation which follows Huang's teaching, where we've had things removed. We can get indentations at the point of the removal, and you can actually fit your little finger in where you've so that must be in the triangular fossa in the pelvic area, where around the uterus point where you've had your hysterectomy. Wow, Jackie, I need a picture of your ears, Jackie, if you don't mind, to go to my ear gallery, my ear library. I didn't know an ear acupuncturist. I knew an ear acupuncturist once. So my talk was reminding you on the wonders of the body. Thank you, Moira. She's had to leave us. I will send you out a recording of this for those people that have had to leave a little bit early. I do appreciate that. It's gone on an hour and a half. Time flies when you're having fun talking about needles, doesn't it? What was that? Oh, you have long COVID. Vagal nerve stimulation via the ear is the only treatment that has helped. The symptoms are great motivators. I sometimes don't perform the movements until I realize my symptoms are returning. Absolutely. The ear is always the final guide, isn't it? We must listen to our ears. And that's something that Olson says, the ear is final guide. And that's something that we need to remember. We can be as accurate and efficient as possible and precise as possible, particularly when we're accessing these limbic system here and the other parts of the brain structures. But actually, what we need to do, we can take away some of the burden and the worry about being so accurate, because we just look to the ear as our final guide, just as you are looking to getting in tune with your body and knowing the symptoms of when things are returning, and you've used that on clients with Parkinson's disease. I'd love to know, just before we go, how do you feel that learning about auricular therapy is going to help you in your practice now? We spoke at the beginning about the struggles. Sometimes we don't understand what's going on in the body. We said, myself included, I still look at the ears and I don't understand what's going on, and we have to kind of like piece it together like a jigsaw. And this is something that Romoli talks about, trying to figure out what's happening in the system is like a jigsaw without the pieces. But what auricular diagnosis or ear assessment, as we're using the term, does is it gives you the finished picture of the jigsaw. So please just pop in the chat for me. How do you think that this is going to help you in your practice and the treatment modalities that you practice with your massage? I mean, Indian head massage is most certainly going to help you. They sound good points for me to massage on a head teacher who is currently signed off with stress. When you talk to Kashmir, who works with a lot of head teachers within her local authority, they are very stressed out. Education is a very, very stressful place to work in. Teachers, all of the staff, including the TAs and the head teacher, they're so stressed. You know, the system is so burdensome. It's so under-resourced. So much is thrown at them. My empathies really do go out to them. And you want to learn more, that's wonderful. And she goes back to Wellbeing Days. So now, you know, you could perhaps teach them reflexology and teach them to look at some of the anomalies. You'd love to combine this with reflexology. It's fascinating. Leslie, I use auricular therapy and auricular acupuncture at the same time as reflexology all the time. When you put together the different treatment modalities using 2 microsystems together, boy, is it powerful. The treatment outcomes and effects that you get are incredible, and the patients will tell you so as well. And thank you, Nuno. We never stop learning. Absolutely, myself included, and that's why I love to connect with you on these workshops. That's why I love you to share pictures of your ears and the ears of your loved ones too. How long does it take to learn auricular therapy? 2 days on our online workshop. And what is the cost? It's £280. But if you look at the screen right now, Jackie, what you're seeing is a 20% off code. I'm not sure if you can see it because I know that you had a problem earlier. 20% off code. So for you, it would be 224 to learn the Attuning to Ear Talk workshop. No, it's not needles because it's online. We're not allowed to teach the practical elements of ear acupuncture online. That has to be face-to-face. I do have face-to-face courses. I do have NADA, and I have my stress and anxiety course as well. And I've got something extremely special coming out very soon. I'm working with Dave Maybe of the Canadian Institute of Auricular Medicine and Du Van Hoffman, who's been working very closely with Kaiser Landgren, and they've been working a lot on the very high-level systematic research on the vagus nerve. And we're bringing something out, hopefully in the summer, that's going to be really, really special and hasn't really been tackled before. I don't want to say too much. You want to study this in the future for sure. Thank you, Jackie. And me too. My CPD never stops either. Dave Maybe is actually my mentor. John Tyndall has been a mentor to me. I've learned most of my CPD with him over the years as well. Rachel Peckham and all of those people that I mentioned, John Begg, they have taught me so much and continue to as well. Are there any other questions before we go? Thank you, Amanda. I'm really pleased that you've enjoyed the presentation too. Any other questions before we sign off? Have I missed any, Nunu?
No, I believe that everything has been responded to. Thank you very much.
Oh, Jackie, your daughter's laughing at you when you were doing the ear massage. Wonderful. That's great. I will say goodbye to you all. Thank you for your time. I hugely appreciate it.
Our last one, Anna.
Sorry.
Apologies to interrupt you. There is one last question. We will answer just this last one from Leslie. With another, can we use seeding?
Absolutely, we can. Yes, we can use needles and we can use seeds. There's amazing research into vicarious seeds, magnets. We can use gold, we can use silver, depends on if we want to tonify or stimulate. Most people's systems will need to be calmed down and nourished. So absolutely we can use seeds on those NADA points as well. Yes, the 16 CPD points, because it's 16 hours or 2 days, Jackie. That's what you'll get, and it's recognised by the FHT, and they will give you those CPD.